Hi, welcome to the virtual tour of the beautiful Family Birth Center at Tacoma General Hospital. My name is Trisha, and I'm one of the nurses that may take care of you during your stay. When you come to the hospital, you can enter through the main entrance on Martin Luther King during daytime hours, or any time of day. The emergency room entrance is an option. Once inside, staff anywhere in the hospital will help direct you to the Family Birth Center. There's a parking garage nearby, or you can take advantage of the valet service if available. We encourage you to pre-register before your hospital stay. This does not commit you to deliver at TG, it just takes the process out of the middle of the night when you're contracting and don't want to spell out your street name. You can find the number to pre-register on the Birth Center website. When you arrive at the Birth Center, your first stop will be at the reception desk. Partners and visitors are required to show photo ID to be admitted with you. This is for the protection of our moms and babies in the Birth Center. The Birth Center is locked 24 hours a day to protect you and your baby while you're with us. Next to the reception desk, you'll find our Birth Center vending machine with the honor box. So bring some quarters or dollars for snacks while you're with us. You will likely begin your stay with us in the OB emergency department, one of our 4 private triage rooms. At this point in your care, only one other person is allowed in the small triage rooms. The point of the triage rooms is to be face-to-face with a nurse and provider to discuss labor symptoms or anything else that may be happening. You will be assessed, and it will be determined if we can safely send you home or if you will be admitted. A common assessment of early labor may be to have you walk around for a few hours and check your cervix again before deciding if it's time to have a baby or not. While we are always here for you, please feel free to contact your provider before coming to triage. You will be given a gown while you're here, but under most circumstances, you can wear whatever you'd like. I like to recommend not to bring your favorite nightgown as it might get messy. Once you are admitted in labor or for an induction, you will go to one of our 13 spacious birthing suites. Before you arrive, we encourage you to think about your birth preferences and perhaps come up with a birth plan. While we do our very best to honor your requests, please understand that babies don't read birth plans, and it is our birth plan for a healthy mom and healthy baby. All of our birthing suites have comfortable jetted tubs, labor beds that can be adjusted into many different positions, both for labor and deliveries, squat bars if needed, birth balls and peanut balls, portable monitoring equipment that allows you to be mobile while in labor if you need to be monitored, TV and free Wi-Fi, many ways to control lighting and temperature for your comfort, a pull-out sleeper with blankets, sheets, and pillows for your partner, and a large private bathroom. For medicated pain relief, we offer a variety of medication as well as epidurals. We have dedicated OB anesthesiologists so that we are not competing with other needs in the hospital. Your nurse is always a great resource for medicated and non-medicated support during labor and delivery. We understand that babies arrive 24 hours a day, so we don't have visiting hour restrictions in this area of our hospital. The Birth Center has multiple areas where family and friends can wait for the arrival of your baby. As the time of delivery approaches, a warmer is brought in for the baby as well as an additional nurse. Your nurse will still be there to care for you, and baby will have a nurse as well. If all is well, our standard of care is for delayed cord clamping and immediate skin-to-skin with mom. This first hour of skin-to-skin is so beneficial for your baby as well as for you. Should you desire to breastfeed, our nursing staff is available to support you at this time. All newborn procedures such as medications and weights and measurements are done right there in the delivery room. Be sure to have a camera ready for your baby's first weigh-in. The baby will be given 2 ID bracelets that match you and your partners. This is to ensure that the right baby's hanging out with the right family. The baby will also receive a little baby low jack that's connected to monitors throughout the hospital. This is to prevent babies from getting too close to our exits. If you have a planned or unplanned cesarean delivery, it will take place in one of our 3 birth center operating rooms. You will recover in your labor room or in one of our private recovery rooms. One support person is allowed in the OR with you during your C-section. Approximately 2 hours after delivery, you will be moved together to one of our postpartum rooms. Your baby will room in with you 24 hours a day. This is a nice time to get to know your baby while receiving support from our experienced staff. While in the postpartum unit, you will have access to a hospital-grade breast pump, a rocking chair, and support from our lactation consultants, should you choose to breastfeed. Our nurses are specially trained in breastfeeding support, so there's not an hour of the day or night that you won't have support in breastfeeding. You will be provided with pads, panties, and everything your baby needs during this stay. Mom's meals are included in the hospital stay, and partner meals can be purchased through room service at the cafeteria and coffee bars, or are welcome from outside food delivery. Please have your car seat base installed and checked before you arrive at the hospital, and bring the car seat upstairs before discharge. Your stay will likely be 24 hours after a vaginal delivery or 48 hours after a C-section. Of course, your provider will keep you in the hospital until everyone is safe to go home. If you need hospitalization but delivery is not imminent, the birth center has 12 private rooms in our perinatal special care unit. Our outstanding team of perinatal specialists offer diagnostics and support during this time. If your baby is in need of a higher level of care, our outstanding neonatal intensive care unit, or NICU, is right upstairs from the birth center. Tacoma General has the only level 4 NICU in the South Sound, the highest level of care available in the state of Washington. We receive transfers from 21 hospitals over 9 counties. We have one of the largest NICUs in Western Washington and have private rooms that offer restful spaces for parents to stay with their baby or babies. We have a team of pediatric specialists, including specialists from Mary Bridge Children's Hospital, available to assist your baby's care if that is needed. Thank you for joining us on our tour today. We look forward to taking care of you and your baby. To maintain the highest level of safety for our patients, our family birth center policies may be changed at times. Please always check our website for the most up-to-date information or consult your provider.